Hey, it's Dr. Lowenstein here at Migraine Surgery Specialty Center. And as I've mentioned in other posts, we've got a migraine quiz to help people try and discern whether or not migraine surgery can be a good option for you. And I just wanted to do another video about part of that quiz, and the quiz is linked here on this post. But one of the things that people complain actually frequently of, and we're going to use our model here, again supplied by a very good migraine surgery surgeon in Europe, Dr. Mühlberger, and again, thank you very much, Dr. Mühlberger, for letting us use these. But you know, a lot of people have pain in the back of their head, the occipital region, and a lot of people will just find themselves trying to massage these areas. They'll have knots or cords back here, and they're just trying to get relief from massaging here. And again, there's a reason for that, and that is that, as we can see here, there are actually 3 occipital nerves that can cause migraines with irritation. This here shows the greater occipital nerve on both sides, and that coming through out of the trapezius muscle here. And so this is just covered by some muscle layer and skin and then hair. And so what people are doing, they're kind of massaging this area, trying to free this up. And you know, kind of temporary pressure on the nerve can prevent these distress signals from coming down. And so it often will give some temporary relief to your headache when it kind of feels good to massage there. And this is why. So when we do surgery on this area, what we're trying to do is free these nerves up from the muscles that are tight and causing this irritation. And this goes again through the trapezius, down through several different muscle layers, down to the capitis muscle, which is one of the stabilizer muscles of your head. And all of these muscle layers, as well as fascia or connective tissue, and actually even a lot of times right up here there's the occipital artery, which can be crossing the nerve, and that can also produce like pulsating pain, because each pulse of your heart, and it puts a pressure head against the blood vessel, which puts pressure on the nerve, and that can cause pulsation headaches, and that can happen here or in the arterial an artery here in your temple as well. But what we do is we go in and we'll divide that vessel if it's an issue. We'll cut the connective tissue that can be putting pressure on the nerve, and we'll make a tunnel through the various muscle layers so everything is kind of relaxed and the nerve doesn't have these pressure points and areas of irritability. And when that happens, we get great relief of your occipital migraines. And it's actually occipital neuralgia, because it's a neuralgia, which is an irritation of the nerve and the occipital nerve, so it's called occipital neuralgia, and very common cause of severe headaches. And so we have great success with that. Again, migraine surgery produces a improvement of at least 50% decrease in pain and 50% decrease in frequency of migraines in 93% of people, and about 40% of people, they just never have another migraine again. So very favorable results. The quiz below can help you to decide if you might be a migraine surgery candidate, and then if that's the case and you'd like to come and talk with us, again, we're at Migraine Surgery Specialty Center, and I've got an office in Santa Barbara and an office in Denver. And at that point, we would do some nerve blocks on you to really confirm that you're a candidate and that we can help. But most people are candidates, and most people we can help, and it can be a life-changing experience, which is a really nice thing for both the patient and the surgeon. So anyway, any questions, give us a call. 805-969-9004 is our office, and we'll be happy to try and set something up to either Skype or talk on the phone or see you in person. All right, hope that helps. Dr. Lowenstein here, and hope you're having a pain-free day.